Hello everyone, welcome to the video identifying ICD-10-CM codes. My name is Capri Stark and I will be your host today on behalf of Jenny Roth from the Department of Human Services and Ruth Ellen Lohr from the Department of Education. This presentation will be over the speech, language, and audiology services. We're going to start with an overview of the big picture, and then we have some speech-specific examples that we hope will be helpful to you. First off, what are the ICD-10-CM code sets? Well, just as a background, the World Health Organization created the ICD-10 codes. They've actually been used in developing countries around the world, and the United States is the last to adopt them. The CM stands for clinical modifications and are specific to the United States, so when you look for code sets, make sure you are looking for the ICD-10 CM code sets. The code sets themselves don't just identify medical diagnoses. They also identify signs and symptoms, abnormal findings, complaints, social circumstances, and external causes of injury or disease. All of these are characteristics of clinical modifications. So what does this mean for schools? Each of the 9 billable services will need to have an ICD-10-CM code attached to them. The first 5 services listed here are the IEP professionals: mental health, nursing, occupational therapy, physical therapy, and speech-language pathology and audiology. We ask that professionals be the people who identify the ICD-10-CM code, which will be for the PCA, transportation, assistive technology, and interpreter services. So let's use physical therapy as an example. The physical therapist determines the child has difficulty walking and falls frequently. The child has trouble transitioning from a seated position to a standing position, which is unsteady gait. The physical therapist will provide PT exercises for strength, but the physical therapist also recommends that the child needs a walker, which would be the assistive technology, and a PCA to assist with toileting, i.e. the PCA will transfer them from the walker to the toilet. And the PCA at lunch would also carry the food tray for the child and transfer them from the walker to the chair and back again. All are related to that unsteady gait. The same ICD-10-CM code used for the PT strength treatments would be used on the claims for the assistive technology and for the PCA services. Here's our grid. There are several types of healthcare providers. Those that can both diagnose and identify signs and symptoms are primary care physicians, speech-language pathologists and audiologists, and mental health professionals. Those that only identify signs and symptoms are professional nurses, occupational therapists, physical therapists, school psychologists, and licensed social workers with 4,000 supervised clinical practice hours or a higher level license. To further define mental health professionals, please see the link in the description below. Who determines the ICD-10-CM codes for other IEP health-related services? The IEP health-related service professional who is training, directing, supervising, or ordering the service selects the ICD-10-CM codes for the PCA services, special transportation, assistive technology, and interpreter services. In most cases, it is the same ICD-10-CM code used by the professional. So let's move on to a student scenario. An IEP evaluation report indicates the child has an articulation disorder and is unable to use speech sounds appropriately for the child's age. The child will need medically necessary speech-language services so they can communicate while they are in school and in the community. In this scenario, the speech-language pathologist searched and found the ICD-10 code F80.0 best describes the speech disorder the child is experiencing. Other than that, there were no other health-related services that the child needed. So now we need to stop and think. Am I treating the disease or disorder, or am I treating a sign or symptom? What code best describes the need for service and the service that is being provided? The speech-language pathologist is treating the speech disorder by meeting with the child 3 times a week to teach the child the production of sounds within words, sentence, and conversation speech. When a child has been diagnosed with a disease or disorder from a primary care provider, report that diagnosis code as the primary diagnosis for all claims for that child. This just means that it is the first in a line of diagnoses. When providing health-related services for a sign, symptom, or condition resulting from the disease or disorder, report that code as secondary, tertiary, and so on. When no medical disease or disorder has been identified, report the sign, symptom, or condition code that identifies the IEP health-related service that is being provided as the primary diagnosis code. An example would be autism. Autism is the disorder that is causing the sign or symptom. So you'd put down autism first, then the symptom as second, and so on. You need to make sure that you are following the thought pattern. If you put a tertiary symptom down as a primary, the system will reject it. Watch for ICD-10-CM code notations. Whether you use an online resource or purchase a ICD-10-CM guide, it is important to read and understand the guidelines and exceptions for selecting ICD-10-CM codes. Select codes are valid and billable. Watch for code notations and rules. The ICD-10-CM code must clearly represent the child's medical need as identified in the child's IEP or IFSP, logically relate to the IEP provider or service, relate to the activities or tasks that are provided, be specific to the child's needs, and select medically necessary codes, not education codes. To qualify for special education, a child must be eligible in one of these educational disability categories: speech or language impaired, developmental cognitive disability, mild to profound, physically impaired, visually impaired, specific learning disability, emotional or behavioral disorders, deaf, blind, other health disabilities, autism spectrum disorder, developmental delay, traumatic brain injury disabled, severely multiply impaired. These are the education disability categories. The direct crosswalk to the ICD-10-CM codes is the speech and language disability category. In other categories, the medical diagnoses are so generic they don't tell us what the specific need is for this specific child, so we cannot identify ICD-10-CM codes and line them up with the education disability codes. School sources for medical diagnosis. A medical diagnosis is a criteria for eligibility for these special education disability categories: other health disabilities, physical impairments, and traumatic brain injury. Speech and language pathologists and audiologists determine the diagnosis for speech and language impairments. Mental health professionals provide DSM-5 ICD-10-CM diagnosis when CTSS is included in the child's IEP needs and plan. Annually, medical orders are required for students needing medication or certain treatments. We recommend adding in a line so that you can enter in the ICD-10-CM code. We also want to clarify that there is a connectedness with ICD-10 codes and special ed work. Your IEP evaluation report has to include the statement that says this child has a medical need and that we need health-related services during the school day. Then, in the record, we will need the health problem identified and what the plan of treatment is. We ask that the code be in the student's file and not the IEP plan. This is because the plan should be in plain language. It is also a privacy issue. Follow your school district's procedures to document ICD-10-CM codes for billing purposes. Some schools will have electronic documentation procedures. One example is a summary sheet for all ICD-10-CM codes for a child's IEP health-related services. This is an optional summary sheet. If this is something that will be useful to you and your team, please feel free to use this form. If a child has more than one IEP health-related service, this is a great tool to use. This might be in the electronic file already if you are doing electronic special education assessments and IEPs. Please take the time to visit with your vendors and make a process that works best for you. Here is the code structure. We are including this so you can visualize what you're going to see, since they are a little different from what you are used to. The first digit will always be a letter, and it identifies the chapter you are in. The second and third digits will identify the category of the chapter you are in, and the last three digits break down that category to a specific topic. Let's break down this example. The F chapter is called Mental, Behavioral, and Neurodevelopmental Disorders. The number 40 tells us that this is a phobic anxiety disorder. The 242 further defines the phobia as fear of bridges. Now we know this ICD-10-CM code is for an individual that has a fear of bridges. It's important to remember that the ICD-10-CM code needs to be as specific as possible. The website www.cms.gov is the official site for ICD-10-CM codes, but we recommend the site we have a screenshot of here. This is ICD-10-Data.com. This is just one of many commercial sites, but we have found this one to be the most user-friendly. Make sure you are using the 2015 ICD-10-CM diagnosis codes. Also, make sure you watch out for coding rules. They can change based on a variety of reasons, such as age or gender. If you don't use the appropriate code, your claim could be denied. Also, if you click here on the 2015 ICD-10-CM Diagnosis Codes Index, it will take you to the index page. Here you can look up the codes by the letter at the beginning of the code by using keywords. Going back to the scenario, the speech-language pathologist determines that the ICD-10-CM code F80.0 best describes the medical reason why this child needs the services that will be provided. No other services are being provided to the child, and no other ICD-10-CM codes are on file for this child, so the speech-language pathologist will report the ICD-10-CM F80.0 code as the primary diagnosis code when billing for the speech-language services. Just so you know, when your billers go out to put this code in, they will not be able to use the decimal point. Because of the way the computers talk to each other, that decimal point cannot be in there, so you will see the code from the scenario come up as F800. It may be necessary to work with both the ICD-9 code 315.9 and the new ICD-10-CM code until all claims for dates of service on or before September 30th, 2015 have been submitted. As a reminder, make sure you use ICD-9 code 315.9 for dates of services on or before September 30th, 2015, then use the ICD-10-CM codes for dates of service provided on or after October 1st, 2015. For additional guidance, please visit any of these sites listed. We will have them in the description below for easy navigation. The Center for Medicare and Medicaid Services is the official site for the ICD-10-CM reporting. The Centers for Disease Control and Prevention, the ICD-10-Data.com, and the MHCP Enrolled Providers ICD-10 link on the Minnesota DHS website are also good tools to use. Here you will find descriptions that go into great detail to help you determine your ICD-10 codes. However, we have found that the CMS.gov site can be very taxing on your computer because you need to download the ICD-10-CM document. That is why we recommend the ICD-10-Data.com site. The information stays current without needing to download an updated document. We'd like to thank you for your time today. Here is the contact information for Jenny Roth and Ruth Ellen Lohr if you would like to reach out to one of them. We look forward and expect to hear from you. Thank you.